as you well know, malaria is a major problem in Africa. There are estimated around 900,000 deaths that occur every year, and 90% of these deaths occur in Africa. So Africa bears the brunt of the disease. And having a tool that is being developed specifically for Africa, this is a new phenomenon. And the partnership that has been brought together to allow this to happen, that's also a new phenomenon. And that's one of the new things that came about, trying to find good solutions for a problem that we have in Africa. The partnership is between the manufacturers of the vaccine, the company GSK, the sponsors who developed interest in finding new solutions in Africa for also in poor countries, the Bill and Melinda Gates Foundation through its program PATH Malaria Vaccine Initiative. And then lastly, the investigators and people in Africa who are participating effectively in finding a solution for a problem that exists in Africa. This is the first time that a collection of the top African scientists come together to work on one goal, find a solution for malaria in Africa. And the process of getting there has allowed the building of capacity in 7 African countries that involve 11 sites in these countries. And these sites have now the ability to conduct evaluations of new vaccines and drugs at internationally recognized level. And that will be of benefit beyond the current efforts to find a vaccine. The capacity will be used to evaluate new tools for other diseases, including TB and HIV, which is also a big diseases in Africa. Most of the deaths from malaria are happening in Africa. If we have a vaccine that is effective against malaria, it will go a long way in reducing the number of deaths that occur in Africa. There is already an experience of the reduction of major diseases that are protected against vaccines. So if you ask today, we don't see a lot of diphtheria or tetanus or tuberculosis simply due to vaccines that are distributed through the central program of immunization. Our expectation is that this malaria vaccine is being developed to be distributed in the same channel and will go very quickly to children who need it most in most parts of Africa. This is the first time that the scientists have come forward to say that they can do the evaluation, they can do properly, they can do it with standards that is acceptable internationally, and they have embarked on implementing that in the appropriate manner. The second leadership is with the communities that are participating in this trial. You have to remember that it's because of the parents and communities accepting to participate in the trial, we are able to do the evaluation. During the assessment in the phase 3 program, we only provide information, technical information, about how the vaccine performs. But there is a lot more that needs to be discussed with appropriate stakeholders to make sure that the decision to introduce the vaccine in the routine vaccination programs takes place. And this involves other stakeholders beyond the scientists who are doing the assessment in the phase 3 program.